Hello, and thank you for joining our colloquium presentation at the 10th International Conference on Food Studies. Over the next 30 to 40 minutes, researchers from DC Central Kitchen, American University's Department of Health Studies, and Common Threads will present multiple perspectives on the delivery of community-based interventions intended to improve fresh food access and nutrition education. We will start with sharing results from the work of DC Central Kitchen in their Healthy Corners program that has expanded purchasing of fresh fruits and vegetables. Next, we'll present findings on behavioral economic strategies that encourage fruit and vegetable consumption in school cafeterias, as well as a nutrition education professional development program for elementary school teachers. Then Common Threads will share their hands-on programming model for improving children's cooking and eating habits. Lastly, we will present the results of qualitative interviews with DC residents that highlight strategies that can be used with future nutrition education programs to better engage families. Our hope is that the strategies and results shared will serve as model interventions communities across the country can implement to improve access to and consumption of healthful foods. Thank you so much for joining our session.
Hi, I'm Laura Balazs. I'm the Director of Food Access and Education at DC Central Kitchen, and I'm here to tell you a little bit about our Healthy Corners program and the work that we do to improve healthy food access in Washington, D.C. So DC Central Kitchen is a nonprofit organization, and we use food as a tool to strengthen bodies, empower minds, and build communities. And we do that through a variety of social ventures that we build to create employment opportunities and break the cycle of hunger and poverty. And those programs span a number of domains. They include workforce development, community meals, creating locally sourced scratch-cooked meals for local schools, and our corner store program, which I'll talk more about. So grocery access in Washington, D.C. is really inequitable across the 8 wards of our city. You can see in this map, the yellow dots are grocery stores in the city, and the blue shading are areas of the city with limited access to grocery stores. So as you can see, there's a huge split across the city and where folks have kind of regular access to healthy food. So that's where we come in. So the Healthy Corners program works with a network of 50 independent corner stores across the city. And we know that corner stores are a vital institution for their customers. We found in our work with American University year after year that more than 60% of customers visit their corner store nearly every single day. This is a regularly frequented spot, but at the same time, the store owners and managers of these stores have a hard time stocking fresh items. They often don't meet the variety minimums of conventional wholesalers and lack some of the infrastructure to stock perishable products. So with Healthy Corners, we're able to supply them directly and deliver to them at wholesale cost fresh fruits and vegetables and a line of value-added items like the fresh fruit that you see on the right here. We can supply them with technology and refrigeration, shelving, baskets, marketing, you name it. We also provide nutrition education. This includes doing tours of the healthy food items in the stores, doing recipe testing and tasting of our healthy food items outside of the stores, and also connecting residents and visitors of the corner stores to other social services. So at our corner store events, we'll have healthcare organizations doing cancer screenings or other social service organizations doing insurance signups or SNAP enrollment. Unfortunately, these education events have been curtailed and postponed by COVID-19. But in the meantime, we have launched a new Healthy Corners customer app to help customers know what the price is and what's currently in stock at their local corner stores. And this also includes some new nutrition education resources. So feel free to download DC Healthy Corners from your app store. So this is a map of our Healthy Corners stores. As you can see, it closely mirrors the blue areas on the map with limited access to grocery stores that we saw previously. And if you look at the red locations, we'll talk a little bit more about those in a second. Those are stores that are currently participating in our SNAP matching program. That's been in operation for almost 2 years now through a USDA Finney grant. Every time a customer comes in and spends $5 with food stamps with their SNAP EBT card and buys at least one produce item, they're able to get a coupon like the one you see in the picture here for $5 in fresh fruits and vegetables. And that program, it was a pilot. It was the first time that a Finney grant had been implemented at large scale just in corner stores. And we weren't quite sure how it was going to go, and it was wildly successful. In that first year, produce sales in the participating stores went up 250%. The stores participating had an average of 32 new produce varieties available in their stores. And in the customer intercept surveys that we conducted with American University, 75% of customers said that they were eating more fruits and vegetables as a result of that program. So we've been really encouraged by that success, both in terms of the customer engagement and then also the store owner engagement, and really understanding the value of selling fresh fruits and vegetables, not just as a benefit to the community, but as a value to their business. So we are excited to continue expanding the Healthy Corners program and building out the SNAP matching program. This year we hope to expand it to a number of more stores, and we look forward to hearing from other programs and receiving questions, so feel free to follow up with us. My email's on this slide. Thank you very much for your time today, and enjoy the rest of the conference.
Hi, my name is Robin McClave, and I'm the Program Director for Healthy Schools and Healthy Communities in American University's Department of Health Studies. The Healthy Schools and Healthy Communities Lab is led by Dr. Stacy Snelling and focuses on creating a culture of health through policies and programs where people live, work, learn, play, and worship. Our work utilizes both Bronfenbrenner's social ecological model and Kumanika's equity-oriented obesity prevention framework to support individuals up to system-wide changes in a variety of settings such as schools, corner stores, and faith-based organizations. For this discussion, we'll be looking at two projects conducted in elementary schools in Washington, D.C. to support improved food access and nutrition education. As we are all familiar with, childhood obesity is a critical nutrition problem in America, with prevalence rates for obesity in children and adolescents aged 2 to 19 years old remaining high for almost 2 decades. Critical to consider are the disproportionate rates of obesity and many other chronic conditions among low-income populations and communities of color. To address increasing rates of childhood obesity, there have been a number of federal and local policies enacted over the last decade. The Healthy Hunger-Free Kids Act of 2010 required the USDA to create updated school meal and competitive food standards that aligned with the dietary guidelines for Americans. This significantly strengthened the nutrition standards for school breakfasts and lunch, and introduced new nutrition standards for foods sold outside of the school meal program during the school day. In Washington, D.C., there was the Healthy Schools Act of 2010, which was most recently amended by the Healthy Students Amendment Act of 2018. And this act established comprehensive requirements for improving school meal and nutrition standards in the cafeteria and vending machines, increasing student physical activity and health education time, and supporting school gardens and farm-to-school education. There was also elements that established local school wellness policies to specifically address obesity and hunger. The Every Student Succeed Act, which was signed into law in December 2015 from the U.S. Department of Education, emphasized the importance of health and physical education by replacing the term core academic subjects with the term well-rounded education, and included these classes in the definition of a well-rounded education. And lastly, layered on top of all of these policies is the CDC's and ASCD's whole school, whole community, whole child model. This emphasizes that establishing healthy behaviors during childhood is easier and more effective than trying to change unhealthy behaviors later in life. It highlights the critical role schools play in promoting the health and safety of young people by establishing the health of students at the center, supported by 10 components within the school environment, and how the community can be engaged for overall success in health and academic achievement. As we've seen over the last 2 decades, there have been many approaches implemented to improve child health and address childhood obesity within the parameters of the aforementioned policies. Frequently, as would make sense, these interventions take place in schools where children spend most of their day. Listed on this slide is just a short summary. There are many other strategies that have been used. Some have shown greater effectiveness than others, and a variety of factors such as school size, student population, teacher engagement, and leadership support all affect the outcomes. Our work in the Healthy Schools and Healthy Communities Lab has mostly focused on strategies to support healthy eating and nutrition education. So I'm going to review 2 of those with you now. First was a taste test intervention to promote vegetable consumption, led by Dr. Stacy Snelling. Taste tests have been used frequently in school settings to encourage acceptance and consumption of fruits and vegetables with positive results. Taste tests allow students to have a voice in the food offerings they will see on the menu. Combining elements of behavioral economics with taste tests allows a psychological principle of self-attribution to take place. Essentially, if I believe I had a choice or a say in a decision, I'll be more satisfied with the outcome. This study expands on the idea of self-attribution by encouraging students to choose among different options for preparation of a single vegetable, with the hope of empowering them with the ability to decide which recipe is used for future school lunch meals. The methodology for this study involved working with 4 schools. 2 served as control and 2 as intervention. Assignments as control or intervention were flipped during the study to give all schools the opportunity to participate in the taste tests, which meant 2 of the schools participated in taste tests for broccoli and spinach, and 2 of the schools participated in a taste test for black beans only. Baseline consumption was first collected for each vegetable, and the smartphone app called V Project, developed by Joseph Price at BYU, was used for data collection, and consumption was measured as one of 3 options. 0% meant not a single bite was taken, 50% was any consumption greater than 0 but less than a full serving, and 100% was the entire portion was consumed. Then, the 3 vegetables were each prepared 3 different ways, and students were able to vote on which they liked best out of the 3. The preparation method that received the most votes was served at 2 follow-up visits. Consumption was then collected at these 2 follow-up visits. At the first visit, 3 signs were posted in and around the lunch line to visually alert students that the winning preparation method was being served. Signage was only posted at the intervention schools. Students at the control schools were not alerted that the new preparation method was being served. At the second visit, no signs were posted to examine whether there was any endurance effect. Results suggest that the taste test competition produced increases in vegetable consumption for all 3 targeted vegetables at the experimental schools compared to the control schools. Visual cues have been associated with increasing fruit and vegetable consumption, and perhaps this contributed to the largest increase seen in broccoli consumption. In thinking about how you can apply these learnings to the work that you do, our results demonstrate that student engagement through choice can encourage students to eat more of their vegetables. By empowering students with the ability to vote for the new preparation method, the likelihood that they will taste the vegetable when it appears again in the future is increased, thereby increasing their exposure to new flavors, which over time can promote healthier eating habits. A necessary element of improved food access in schools is engaging and empowering students in the process. We all know the adage, you can lead a horse to water, but you can't make him drink. As you think about future efforts to support student health, be sure to consider how students can be involved in the process from the start. Next, I'll be sharing the results from Healthy Schoolhouse 2.0, led by Drs. Snelling, Irvine Belson, and Hawkins at American University. Healthy Schoolhouse 2.0 is a 5-year project funded by the USDA's National Institute on Food and Agriculture. For today's discussion, I'll be sharing the intervention and results from year 1 only. The impetus for Healthy Schoolhouse came out of previous research conducted by Dr. Snelling and colleagues at American University. She found that teachers understand the importance of health and nutrition education, but lack the self-efficacy to incorporate it into an already packed curriculum. Thus, the Healthy Schools team sought to engage and empower teachers so they could seamlessly build nutrition education into the lessons they were already teaching. The goal of Healthy Schoolhouse 2.0 is to improve health literacy and prevent obesity in elementary school students in Washington, D.C. To achieve this goal, the program team designed, implemented, and evaluated the following activities in year one of the project. The education component is focused on professional development sessions for teachers that covered both personal health topics as well as content from each of 3 lesson modules in the USDA's Serving Up My Plate, a Yummy curriculum. The goal was to first support teachers' health and wellness with the beliefs that they would then teach this information to their students. The second component relates to research and how we're measuring the impact of our work. At schools participating in Healthy Schoolhouse 2.0, we are collecting baseline and follow-up data for each school year from both teachers and students in grades 1 through 5. We are also measuring consumption of fruits and vegetables in the cafeteria at both our intervention and control schools. The extension component is the work we do outside of the classroom by supporting Martha's Table Joyful Food Markets to help the lessons and content take on real-world relevance for students. Joyful Food Markets are monthly pop-up farmers markets for students and families at elementary schools in underserved neighborhoods of Washington, D.C. Martha's Table distributes fresh produce and dry goods with cooking demos and fruit and vegetable tasting for students and parents with fresh ingredients from the market. This aligns with principles from the work previously discussed about taste test interventions. A team from American University attends each Joyful Food Market every month to lead hands-on health and nutrition activities for students that were fun and active. So here's what we found after year one. One of the major takeaways was the importance of teacher engagement. The more professional development sessions teachers attended, the more likely they were to teach lessons to their students. The foundation of Healthy Schoolhouse is built upon the existing relationships between students and their teachers. The USDA curriculum was designed to fulfill required learning standards, helping to reduce barriers around teaching nutrition education. We found that nutrition education can be incorporated into other subjects and can make a difference in student health. As we know from previous research, healthy students are better learners. But preceding that, we need to support the health of teachers for sustained improvements in student and child health and equip them to be successful long-term. Supporting improved food access and nutrition education is not a one-size-fits-all approach, nor is there a particular sequence of events to follow. However, by placing an emphasis on student health through federal and local policies, schools are able to create an environment that links child health, the school culture, and engagement from community that can lead to sustainable health improvements over time. As we saw in our taste test intervention, giving children a voice in how their food is prepared can improve consumption and potentially lead to stronger participation in the national school lunch and breakfast programs, which could lead to improved student nutrition over time. In Healthy Schoolhouse, by empowering teachers with health and nutrition education, we saw an increase in nutrition lessons taught. Over time, this can lead to improved health literacy and nutrition education among students. Thank you so much for your time, and please feel free to reach out with any questions about this presentation.
Hi, my name is Dawn Susie, and I am the Senior Program Manager with Common Threads in New York City. I've worked for Common Threads for a little over 3 years. I oversee the growth and development of schools and various community-based organizations throughout all 5 boroughs, while continuing to develop partnerships for further expansion of our nutrition education programs.
Hi, my name is Shayna Alford, and I'm the VP of Research and Evaluation at an organization called Common Threads. I've been at the organization about a year and a half, and in my role, I really try to focus on capacity building, building the capacity for the organization to make data-driven decisions, making sure that we're able to evaluate our own programs, and also thinking about the importance of applying DEI in research as well as program design. I have a background in both food security and community health, and so I always try to bring that perspective as well. Common Threads is focused on two main things: nutrition and cooking. Our vision is to build communities that embrace healthy cooking, a healthy lifestyle, and the celebration of culture. But we can't do that without our partners. And so we work collaboratively with community partners to offer nutrition education classes and cooking classes to not just children, but also families. That includes grandparents, parents, siblings, whomever else wants to join. In 2018, we partnered with American University in Washington, D.C., and they did an excellent job at conducting research with a small subset of families, particularly mothers and children, and with the focus of learning about their healthy eating habits, their consumption and cooking of food, as well as their perceptions of healthy food. It's always important to hear from families that you're programming with or that you're supporting with services. And so we learned some important things, not necessarily things that were very new, but important things to learn and confirm from our families. Number one, moms are the ones taking the lead, oftentimes in their households when it comes to healthy cooking. They're the ones who are shopping for the food, so they also have a lot of say in what goes on the table. However, they are also constrained by time, by children, by different preferences in the household. So it's a competing challenge sometimes to constantly push for healthier foods if the family is not as receptive. But when the family is receptive, children did want to get involved in the cooking, and they did want to be involved in the shopping process, which helped things out. Also, moms are using technology. Technology is critical. They're searching online, they're Googling, they're going to Food Network websites to get healthy recipes. And so it's important for information to be available, free, and convenient. Also, moms are well aware of what some of the importance of healthy food, whether there is a chronic disease present or not. Moms really wanted to take ownership of making sure their household was eating healthy, but they reported that the most common challenges were just time, not being able to always cook, which led them to sometimes buying McDonald's or other cheaper options that were readily available. Finally, again, cooperation of spouses and children and getting buy-in from grandparents to reduce sugary food and beverage consumption to help them along on the journey of healthier eating was something that was also mentioned. Finally, a really important insight that is important to further investigate is just how moms talked a lot about mental health and stress and really broadening the discussion from just food and diet to including stress and mental health.
Let's go over a quick recap of our program activities for 2019 and 20. So here's a quick look of our in-person programs across the U.S. August 31st, 2020 marked the close of the 1920 school year. To date, we have 313 partners across 388 locations. We are in over 66 school districts and numerous community-based organizations. In total, 45,800 participants took part in our Small Bites in-school nutrition education program, as well as our after-school cooking classes. Of those, 37,400 were students and 8,400 were adults. A total of 290,000 meals and snacks have been provided this school year. Then COVID-19 happened. Common Threads responded to COVID-19 by going 100% virtual with our nutrition education and cooking classes. So what stayed the same? We kept as much of our in-person curricula as possible, using interactive and hands-on snack making and cooking. All of our nutrition lessons about food and healthy recipes stayed the same. What changes did we make and what challenges did we face? Lessons are now taught by chef instructors and Common Thread staff instead of teachers. Getting fresh ingredients to the students and family was challenging due to limited availability. Virtual platforms like Zoom introduced a variety of technical problems that we have since resolved. To combat SummerSlide, Common Threads offered a virtual summer camp to all of our students in all markets. In addition to our nutrition education classes, physical activities like yoga and SEL modules were offered. As part of the camp, we provided groceries and a kit for the campers that included a chef hat, apron, a cutting board, and many other fun items. Common Threads partnered with restaurants and food suppliers as part of our Family Meals initiative to deliver food boxes to families in Chicago, New York City, LA, and Washington, D.C. To launch this initiative, we communicated and coordinated with school districts, chefs, and grocery partners, all of whom are integral to the success of our programs. Families received reheatable meals and grocery boxes containing fresh produce, as well as shelf-stable items like kale, lentils, and bananas, just to name a few. Flyers from Common Threads with recipes that provide guidance on preparing easy and affordable and nutritious meals were also distributed.
This slide is titled Parents Say It Best because parents do say it best. This is a collection of quotes that parents offered to us when we followed up to find out how summer camp went with their children. And they had a lot of great things to say, especially about the confidence that kids built during this time in learning how to cook. Although it was online and it was in a virtual space, there was a lot of interaction and a lot of opportunity for children to practice. This concludes the end of our presentation. I'd like to thank my colleague Dawn in offering her time to record. And we hope that you enjoyed learning more about Common Threads and what we've been doing since COVID-19, as well as some of the successes and challenges that we've faced and worked towards overcoming. On the next slide, you'll find our emails. If you're interested in following up and learning more about us, please do not hesitate to reach out. We'd love to hear from you. Otherwise, we hope that you enjoy the rest of the conference and that you are able to listen to learn more about the research being conducted by American University, as well as the programming and outstanding work that DC Kitchens is doing. Thank you.
Hi everyone, thank you for listening today. My name is Liz Cotter, and I'll be describing the qualitative research that American University conducted in partnership with Common Threads. The goal of this research was to learn directly from families about their experiences with cooking. Just to tell you a little bit about myself first, I'm an assistant professor in the Department of Health Studies at American University. I'm a psychologist by training, and my research is focused on two areas: the prevention and treatment of eating-related concerns and mindfulness-based approaches to improving health behaviors. I'm going to present more details about the qualitative research that Shana and Dawn introduced earlier in this presentation. The goal of this research was to learn directly from families and key informants in Washington, D.C. about their experiences, challenges, and successes related to cooking. When formulating and conducting the research, we wanted to keep an equity approach in mind. We referred to a model put forth by Kumanika, which essentially indicates that obesity prevention efforts have recognized but not adequately addressed challenges that communities at higher risk for obesity face, and these challenges maintain inequities. So keeping this framework in mind, we wanted to further understand aspects of our participants' social and environmental contexts that might deter or facilitate their participation in programming, and also deter or facilitate the sustainability of what is learned. Here's a brief overview of our methods. We recruited children, parents, and key informants across Washington, D.C. through partnerships with organizations that were affiliated with Common Threads cooking programs. We recruited 33 children from a public summer school program and an academic achievement program. We recruited 22 parents through a healthcare clinic, several affordable housing communities, and a local nonprofit for families. Our key informants came from a range of community partners across DC whose work is focused on health and food. Parents and children took part in focus groups, consisting of anywhere from 4 to 10 participants, while key informants were interviewed individually. And you can see some sample questions that participants were asked on this slide. We recorded each of the interviews and transcribed them. Then, to analyze the data, members of the research team read all of the transcripts and met as a group to develop an initial set of codes that represented the content across interviews. Then in dyads, members of the research team independently analyzed and coded each transcript and met with their respective partner to discuss any discrepancies and to come to a final consensus about coding. The research team also met weekly to review each dyad's coding and further refine the codebook. So in terms of our results, I won't go through every theme that we identified, but I will present a summary of the most salient and overarching themes across interviews. So mental health and its relationship to cooking and eating was discussed frequently. Parents highlighted that they considered health to be holistic, so consisting of social, spiritual, physical, and emotional well-being components. Parents talked a lot about their mental health, and how some felt that stress impeded their ability to cook healthfully and to create a healthy environment for their children. Participants talked about how stress exacerbated existing conditions like diabetes. Others mentioned concerns about depression, or stress from being a caregiver and not feeling like they had enough time for themselves. A second theme was accessibility. Parents talked a lot about the cost of healthier foods. Both parents and key informants discussed challenges living in areas considered food deserts, and they also discussed wide availability and marketing of less healthy food items like soda and fast food. Both parents and children spoke about family members being a facilitator and sometimes a barrier to healthful eating and cooking. Both parents and children discussed learning from members of the older generation, particularly grandparents, about preparing healthy meals, and they talked about how grandparents passed down knowledge and recipes and health advice. Parents discussed how children's and also their partners' picky eating sometimes precluded them from serving healthier options. And children talked about knowing the types of foods that they should be eating, but then sometimes being served foods at home that they knew were less healthy, so that didn't fit into the guidelines that they knew. Focus groups also highlighted a desire for experiential learning. Parents and children reported that they have a basic education about healthful eating and cooking, but they desire more hands-on skills related to preparing meals quickly and inexpensively. So they know the what, and they're really looking for more of the how. In terms of program logistics and dissemination strategies, parents talked about time constraints and the importance of meeting them where they're at, rather than expecting them to come to programming in the schools. Key informants suggested incorporating virtual messaging, like text messages or YouTube videos to reach parents. And kids similarly expressed an interest in learning about healthy cooking virtually. So I'd like to just put some of our results in context by summarizing relevant past research. Clearly, parents are an important focus when it comes to children's health. Parents are responsible for the majority of school-aged children's meals, and parents' eating habits, like consumption of fruits and vegetables, are predictive of children's eating habits. Yet we also know that stress in parents' and caregivers' lives influences the degree to which they can provide a healthy environment for their child. And this is true even after controlling for socioeconomic status. Some research suggests that parents under stress are more likely to serve fast food and more likely to use food as a reward. This further highlights the need to involve parents in children's nutrition education programming and consider a mental health component, which I'll talk a little bit about in the next slide. Parents in our study and in many other qualitative studies have described structural barriers to cooking like access to healthy, affordable ingredients. And indeed, public health research indicates that health interventions are much more successful when they include components that require lower levels of individual agency and instead help create a supportive environment. So key partnerships with organizations that allow for increased access to healthful ingredients, like local food pantries or produce prescription gardens, are essential to enhance efficacy of cooking programs. So to describe a few more implications of our findings, we believe our results suggest that cooking programs should take a holistic approach to health. This is particularly true during the COVID-19 pandemic, when mental health concerns are amplified. Examples might include incorporating stress management activities into cooking programming, like brief meditations, breathing exercises, or mindful eating exercises. Cooking programs can also increase opportunities for social connection and support, and then, of course, provide mental health referrals whenever they're needed. Given families' busy schedules and competing priorities, programs should consider using technology to disseminate cooking information to parents, such as text messaging or brief educational videos. Again, this will be particularly helpful during the pandemic, and Common Threads has served as a great model for this through their virtual programming and online resources that they provide through the Small Bites Virtual Nutrition Education Program. After the pandemic, programs should consider providing small doses of education in settings beyond the school system, such as grocery stores, medical clinics, farmers markets, food pantries, and so forth, just to increase their reach and convenience to parents. And as mentioned before, these key partnerships could also allow for increased access to healthful ingredients and just increase the sustainability of programming. To conclude, I'd like to acknowledge and thank our community partners and members of the research team, without whom this work could never have been accomplished. Here are the references that were used in this talk. Thank you very much for listening today and for giving us the opportunity to share this research.